Welcome back to the Quantum Couch. In this episode, we're going to be speaking with Dr. Faryal Mallick, who is a psychiatrist in Tampa area of Florida. We're going to be covering subjects such as various modalities of healing that she incorporates within her practice. We'll discuss vision boards and one that she has created for the year going forward. We're going to be speaking about ketamine-assisted psychotherapy, which is a very important treatment for treatment-resistant depression. And I find it very fascinating. I know very little about it. And so this would be a great conversation. And many, many other things that we are covering. She is a very interesting person to speak with. She is triple board certified, which is impressive in its own right. So without further ado, Dr. Faryal Mallick, welcome to the show.
Thank you so much for having me.
I'm really excited that you're here. I was a guest on your podcast, was it a few months ago? And I think the recording will be coming out the next month or so. So I'm excited about that. And now you're here on mine. So
Yeah,
welcome.
thank you so much.
Could you tell us a bit about yourself? Introduce yourself, please. And we would love to know.
Yeah, so I am a child, adolescent, and adult psychiatrist. I'm also trained in forensic psychiatry, board certified in all three. And psychiatry is my passion. I enjoy it. I enjoy psychotherapy, especially psychodynamic psychotherapy, a lot. And my practice is focused around therapy. Um, I practice in Tampa, Florida. And as I was doing, therapy with my patients or even my medication management patients, I realized that I was telling them, hey, go do yoga, stretch, meditate. And they weren't doing it. So I decided that I also have training in group psychodynamic psychotherapy. So I wanted to run some groups. And so I decided that I wanted a little bit bigger space than my teeny tiny office. And so when I was looking for a space, the idea started expanding into, okay, how can I make it so that the whole person is, being taken care of? Their inner beauty is taken care of. So yeah, that's where like my clinic idea came from, which is what I call it is a mental health spa. So it's a spa for your mental health or your mind. And we offered holistic services like yoga and sound baths. And I know that somebody came and talked about sound baths in very much detail, which is I was so impressed with that episode. We do mind body events where we bring creativity in, where we'll use our hands to create something, and then we'll kind of transition into a sound healing or yoga. I have like some really nice zero gravity massage chairs that people use during those events. And if somebody's interested, they get IV hydration.
Whoa. I mean, you
Yeah.
really are combining so many different things.
Yes. And so I have an infrared sauna that has chromotherapy. So,
Wow.
we have assisted stretching. So, there's a lot of different modalities that people can utilize to help, help their overall mental health. And you don't have to be a patient to be utilizing these services. These are open to the community. Yeah.
That's
So,
incredible. I wish you had something like this in the Philadelphia area. Then I would utilize it all the time.
yeah.
I mean, it's amazing because you're you're a jack of many trades. Like you apparently, you mean you obviously are board certified. You're board certified in adult psychiatry, child and adolescent, and forensic.
Mhm.
That is incredible in itself because for those of you who don't know, keeping up with one board certification is a pain, but keeping up with three, I can't even imagine what that entails. And then you're also doing a lot of these things under your roof, but you're
Mhm.
not doing all of them yourself, correct? You're having people
No.
doing this for you. You're
Mhm.
not like doing sound baths yourself, right?
No, no, no. I have healers that come and do it. That's why I was impressed by your guest who does them herself, which is I thought was amazing. But I have like absolutely amazing sound healer. She's gifted and so intuitive. She'll pick up on things. Sometimes my therapy patients will attend the sound baths and she'll later on be like, this, and this. And I'm just like, how did you pick up on this? Like, so it's actually like what is going on with the person that she'll pick up on. So she's just very gifted, and has studied sound so much and knows exactly what frequencies to play. So, whatever is not my expertise, I won't, I don't meddle with it. I don't get into it, and I let the experts do their thing. So I'm not yoga certified. We have like yoga um trainers, teachers come in to do the yoga. So IV hydration, I had to practice my IV skills. So
Wait, so you provide IV hydration yourself?
I have started IVs a few times and I didn't have anyone else to start them for me, specifically for my IV ketamine-assisted psychotherapy. So,
Mm. And you do
uh,
that too, right?
yes, yeah. A few times I like couldn't match the time because then it becomes three people, a nurse, me, and the patient trying to figure out a time where we can actually do this. So I just was like, okay, you know what? In med school, we did it. We should do it. We're doctors. So I brought it out, practiced on my husband, and
Poor husband.
and he's a hard stick.
Really?
So yeah, he's a hard stick. And I got him, a few times in the first try. So I was like, okay, I can do this. I got it.
Go
So yeah.
you. I mean, there are so many different questions I have at this moment. How did you decide that you want to incorporate yoga, sound healing into your practice? I mean, why were you even recommending all this to your patients, even though you are psychodynamically trained, you're a psychiatrist? Why
Mhm.
those modalities?
Yeah, so in residency and then in my child and adolescent fellowship, I decided that I wanted to like do a little bit of all kinds of therapy. And so I was lucky enough to have supervisors that even though our main like residency focus was CBT and psychodynamic psychotherapy, I decided that I wanted to do a little bit of DBT, kind of learn it, and then acceptance and commitment therapy. I was basically spending extra time, you know, my own time into learning these things. So, for instance, the DBT, right? That came from so many people having borderline personality disorder and my classmates actually being like, I have this patient. Can I just send them to you? Because somehow I realized that I was able to tolerate them because a lot of people can't, right? With
Mhm.
the whole splitting and the emotional highs and lows. So I somehow was able to tolerate that. And so I got into DBT, and that's where I got into mindfulness meditation.
And what do
That's like,
these 2 have in common for
so
those
that's
of
like
people who don't know DBT at all?
yeah. So mindfulness meditation is like step one in DBT. That's what you
Mm.
teach them. You are
And
teaching
DBT stands
them
for
breathing. Sorry,
and what does DBT stand for those of people who
dialectical
don't know?
behavior therapy. Yep.
Dialectical behavioral therapy. Mhm.
Yes. And so, you're teaching them emotional regulation and, just techniques, how they're going to manage their emotions when they're highs and lows and like interpreting situations. And you get into that, but you start with the breathing practice.
Mm.
So that's where I got into the meditation part. And so even when I wouldn't be doing, DBT, I would like do some breathing exercises and some meditation with my patients. And I'm not mindfulness, certified because now there's certifications in
Sure.
that. And, I have a friend who's a therapist who I call him the Buddha. Like he knows mindfulness in and out and in a lot of depth. And so he actually converted and practices, if it's a conversion, practices Buddhism.
Mhm.
And so, his mindfulness practice is way up here, but I can at least incorporate some breathing exercises into my patients, practice, daily practice. But then combining that with stretching, holding the stretches, not the yoga where you're just like speed yogaing and make it into the into a cardio,
Not the
but
American version of
right.
yoga.
Just holding your poses and breathing through them, right? Actually stretching is, what I wanted everyone to do because I found it beneficial for myself to slow down and just breathe. Because our life is go go go, like you said. We made yoga into go go go. So our lives are just like that. We're so busy, from jumping from one place to the other. We don't even take a moment to actually take a breath and slow down. So, a lot of the modalities that I offer are something that I have experienced with myself, and I've found them to be very beneficial. And bringing down, even like if somebody doesn't have depression or anxiety, in just bringing down the stress levels that we
Mhm.
carry.
Sure.
Um, because the stress can lead to a lot of things. It can lead to, sure, problems of the mind, psychiatric illnesses or mental health problems, but it can also cause a lot of body issues, physical issues, right? Physical illnesses, heart problems. So that's how I kind of like just brought it in, and I would teach them, mindful breathing, paying attention to their breath, and I would practice it with them in the session, but I'm not a yoga teacher. You know, I don't do assisted stretching, so I would tell them to go and, get these things, but it was hard for them to find another space to go to get
Sure.
these modalities. And that's
Absolutely.
how I ended up being like, okay, you know what? I need to bring all these healers, they're all independent contractors, in to offer it in my own space so that I can be like, hey, on your way out, schedule. Schedule before our appointment or after our appointment.
And what is your space called?
It's called FMP Mental Health Spa. The FMP stands for Fostering Mental Peace.
Ooh,
Yeah.
FMP mental spa, right?
Yep.
FMP mental.
Mental health spa.
Love it. Yeah, as you're talking about stretching and meditation, I was in my probably late 20s when I really got into yoga. I mean, I was doing yoga even before then, but seriously got into it where I was doing teacher training. And at
Mhm.
the same time, I was also meditating regularly and I was in regular psychodynamic therapy myself. And I found that while my therapy was amazing in itself,
Mhm.
the yoga and meditation really complemented the psychotherapy piece because
Mhm.
often when I was in a stretch for an extended period of time,
Mhm.
I would
Mhm.
find myself being frustrated. A lot of feelings come up. Like you're in this in
Right.
between space. You're in the space of discomfort. And a
Mhm.
lot of stuff comes up in your mind. You're like, oh, I hate this, or I want to get out of it, or like, I can't tolerate it. And then you watch yourself, or you observe yourself, and then you realize how much of the stuff that happens on the yoga mat is very often reflective of the things that happen outside of the yoga mat in your daily life. And then
Absolutely.
once you learn how to breathe through the discomfort and the things that come up in your mind while you're in this yoga position, you can also utilize it outside in
Mhm.
the real world. So
Absolutely.
I find yoga and meditation, I mean, there's so much research about mindfulness
Mhm.
meditation
Mhm.
being helpful in itself for
Mhm.
various mental health well-being aspects. But the yoga piece, I think, was very crucial because also it provided a somatic
Yes.
release and somatic insight into some of the things that I was talking about in therapy.
Yes.
And it was like the boundaries or frustration tolerance or anger, like so many different things were reflective in this yoga
Mhm.
practice. It was
Mhm.
pretty amazing. And unless you actually go through it, I think it's very difficult to understand how that
Right.
would even
Yeah.
be possible. It's
Mhm.
an
Yep.
experiential process.
Absolutely. And so talking about yoga, I actually even became a bigger fan of assisted or facilitated stretching.
Hmm.
And I was introduced to that through I was doing some intense workout while I was in my forensic fellowship, and my every single part of my body was aching, and you know how they say it's gonna get better with time? It wasn't getting better with time. So I started going to a massage therapist, and he was a sports massage therapist. And so during our session, he would like do assisted stretching instead of just like, rolling out the massage. And I was just like, it was so helpful that when I moved to Tampa, I immediately looked up, where can I get assisted stretching? And luckily there's like this chain called Stretch Lab. There was one really
Huh.
close by, yeah, and I started going there, and that was, like, an absolute investment I was happy to make because not just, like you said, it's being held in your breathing, and they tell you to, count your breath while they're holding your stretch, but also we carry so much stress and trauma in our muscles and in our
Mhm.
body, right? Like, I'm always like this, I have to pull back to,
Mhm.
like, tell myself to relax. This is how we are. All of our muscles are like this all the time. You have to actually tell your body to relax. So when they're holding the stretch, there's an actual active release of stress
Yeah,
from and
absolutely.
trauma and, all of that stuff that you're holding in your body because the mind and body are connected. So I really liked that because some people just don't have the flexibility to hold certain yoga poses and are tight from working out or whatever, and they can't. And so when somebody's helping you, assisting you hold the stretch, it opens things up and then you can actually practice yoga on your own too and stretch on your own. But that assisted stretching, I mean, I am such a huge fan of it. I'm like, this is better than massage because you don't after massages, sometimes you're feeling more pain because they've tried to, like, kinda get your
Sure.
knots out. This is not gonna put you in pain afterwards. It's just gonna release some of that tension and, slowly start to relax those muscles and get the knots out slowly, by stretching it out rather than just, trying to roll it out.
Yeah, absolutely. I mean, we're talking about the body and the tension that it holds, and you and I are psychiatrists, so we were
Mhm.
trained more to talk about kind of feelings and thoughts through conversation, like, it's all
Mhm.
about talking, but there's very little physicality involved in what we do as psychiatrists, and I
Mhm.
think that we're doing, a lot of disservice by separating the mind and the body. Um, and I think the more I do this work, the more I realize that there's only so much I can do with psychodynamic psychotherapy for
Mhm.
especially for people who have deep-seated trauma that's even beyond words, like when it was happening maybe in the first 5 years of their life. It's so difficult to access those memories, those feelings, but when you're doing physical, release, you don't need words for that. The body knows, the body stores it, and when you're
Mhm.
doing this, it actually really brings up a lot of these memories and feelings that you're processing, but not maybe consciously. It's just coming out.
Mhm. Yeah, I absolutely agree with that. Um, it's with and I like the combination of the 2 because you're right, psychodynamic psychotherapy is not gonna get us too far. There's only so much we're gonna get to, and I don't like forcing people to remember their trauma anyways. Like, if your mind blocked it, if it comes up, sure,
Sure.
but I don't want you to be forced your brain decided to block it for some reason. There is a reason there, some sort of protective reason. So if it comes up, great. If it doesn't, we're not gonna try to, like, pull it out and then try to process it.
Mhm.
Let's look forward and see where things are coming up and how we can, fix those things, but as those things are coming up, like, I have a physician that I'm seeing for psychodynamic psychotherapy, and she was like, "This is hard work." And I was like, "Well, you're putting in a lot of hard work very quickly, so maybe slow down," you know? But she was like, "This is hard work. So much stuff is coming up that it's overwhelming," and at
Yeah.
the same time, she's like, "My problems are, like, not that big, like, I feel silly talking to you about these," and I'm like, "No, your problems are real." Like, there's a lot of rooted, deep-seated things that you have just never explored or talked about, and they're
Mhm.
there, and they're causing grief, like, nonstop,
Mhm.
um, and so, I mean, she doesn't have a diagnosis of depression, she doesn't have a diagnosis of anything, we're just working through all of this trauma that she's carrying,
Mhm.
and and then the body starts to, like, be like, "Oh, this is hard," and so then that's where it comes in, "Okay, how about, like, go stretch, go for a walk, you know, slow down." Pay attention to your breath. I also talk a lot about mindful eating
Oh,
because we will how do we have dinner? Um, Even if we're at the dinner table, it's nonstop, like, bickering about the whole day, right? If not, because most of us don't have any time to watch television, we're watching television while we're eating. So our attention is not on our food. Um, so I'm just like, turn everything off, sit quietly, pay attention, look, use your five senses when you're eating, like look at it, smell it, taste it. Actually pay attention to it and take deep breaths before you take every bite so that you're slowing down and actually just kind of enjoying the food in front of you. Um,
what do you recommend for parents with kids who have a propeller on their butt and who never sit still and whose attention span is that of a worm and we can't really concentrate on the pleasure of the food. I mean, we eat like my family, for example, we eat as a family
mhm,
almost every single night. We try to do it breakfast as a family, we try to do dinner as a family. Peaceful they are not. Like they're it's just like the dinners and the breakfast, they're pleasantly chaotic. We do it together, but with two little
mhm.
kids, it's really difficult to eat mindfully. Do you have any recommendations for families
Right.
like moi?
Yeah, so absolutely. So I say start really, really young, right? Talk about what you cooked that day or what you're having in your meal, right? Take that conversation there that, okay, I know you're excited, but let's see what we made. Do you know what this is? Right? I want you to tell me what it tastes like, right? Their hyperness, like, kind of move it
Mm.
to the actual food because they can be hyper, right? And still, as they're putting a bite in their mouth, I don't know how old your kids are, but whatever you practice from the get-go, they're gonna learn, right?
That's a really good idea. They're 7 and 5, so this is a very good time for them to start
Mhm,
learning, but it's a good idea to ask them, like, "Let's play a game and see, like,
mhm,
what does this taste like? What can you tell me from putting it in your mouth, what it feels like?" That's actually
mhm,
excellent. I
mhm,
think they would like the idea of a game as opposed to, like, "Let's
mhm.
mindfully eat."
Yeah, exactly, right? Like, make it into a question and answer. Okay, what does this taste like? You know, do you like it? Like, what do you think what spices can you taste or smell? Just like fun like that, because then they'll start paying attention to what they're eating. I actually have a parent, and I'm very impressed with this parent. I think his kids are also, I'm gonna say 4 and 7 or something, that age range,
Mhm,
and so when he cooks, he involves them in it. He's like, "Okay, put this, like, on the salt on the thing, right? Or, you can I've cut this up, you can put it in the pot," or
mhm.
whatever he's cooking in, right? So he involves them even in the cooking process, and I'm so impressed, that's not for me. He was just telling me himself that he really enjoys doing that with his kids, right? So, you're gonna end up cooking anyways, right? So, bringing them in, I know that ADHD, they're very distracted, but I myself have ADHD and I'm all over the place. But you slowing down, right, and asking them, "Hey, do you want to come help me? I'm gonna cook this very interesting, meal today. I'm making chicken marsala, right? And I need help. Come help me, right?" And see if they might not. They might be like, "I want to watch television," right?
Or play Mario Kart.
Oh yeah, exactly. Um, or you can be like, "You know what? I'll give you extra time on Mario Kart if you come do this with me and see what we're putting in. And then when we're eating, we'll talk about what you taste out of the stuff that you put in the meal to cook it."
I like that. I really like that idea. Um, Speaking of thinking outside of the box, I was looking through your social media and I saw that you had a workshop on vision boards. And we're
Mhm.
taking, I'm wondering if maybe we can take a little bit of a detour because I'm so interested in one. I've actually never have done a vision board. How did that idea even come to you to do a vision board in your practice or in your collective,
Yeah.
in your mental health spa?
Yeah.
And kind of, can you please tell us a bit more about that and what we can do maybe with creating a vision board for this year of 2026?
Right. So it's so funny that you say that you've never done one. I had never done one until last night
Really?
either. So I saw other people doing it, and to me, it was like, huh, okay, this is interesting. And people would make it into a party, and like, girlfriends are getting together and doing this. And so my sound healer, Christine, amazing human being, she was the one who came up with the idea that, let's do a vision board and like kind of transition into a sound bath. So whatever like they put together, then the sound healing will kind of integrate it for them. And I was like, okay, let's do it. I mean, she has some fabulous idea. She comes up with these fabulous ideas. And so we were like, let's do it. Because for me, it becomes a mind body activity, right? Because you're picking out, little quotes or pictures. And so you're using your senses
And
and then
mindfulness.
yes, exactly. You're slowing down to do all of this, right? And
Mhm.
in order to actually bring all five senses in, I also added herbal tea to it so that,
What?
you can taste and smell
I
as
love that
well.
idea. Wait, so you were doing this vision board and you were drinking herbal tea? Is that what you were
Mhm.
doing? Oh
Yep.
my God, sounds amazing.
And I have like a super cool collection of these different teas that have like different purposes, and they have like different flowers that those teas came from, so people can choose. And you can actually, I do this with people, and I tell them, okay, what do you taste? What do you think is in here? I want like you get to flip the box over to see what's in there after.
No
So
cheating.
yeah, no cheating. So, like just bringing in your taste too. So you're literally using all your five senses at that point. So for me, like the concept behind vision board is that what do you see for the year for yourself? And I'm not a huge fan of making goals or, putting that pressure on yourself of okay, this is what I want to have this year, or this is what I envision, and then that not happening, and then you're disappointed, and then you start getting depressed, right? So it kind of is like resolutions.
Mhm.
I will be posting this on my social media. January 17th is let your resolutions go day or something like that. It's like an interesting name to it, but somewhere where your resolutions go to die right about at 3-4
Mm.
weeks into the new year.
Yes.
So yeah, I'm not about that. So my idea behind it was Christine's idea was like, okay, whatever your vision is, she believes in manifestation, which I do too.
Yep.
Whatever positivity you put out there will come back to you. And so I believe in manifestation, absolutely. But after the holidays and during this time, there has been already so much pressure placed on people that I feel like vision board might just add another stressor. So what I explained to people was that it doesn't have to be a vision. Let's play with the unconsciousness a little bit here. And that's what I am going to do. I'm just going to grab whatever calls to me at that time and throw it on this board
Ooh, like a
and see what
collage.
comes out, right? And then if you want, I can sit down and interpret it with you, or we won't, right? And you can see what you see and take that
A
with you.
collage of unconscious thoughts. Love
Yes.
that.
Yeah. And if you give me a minute, I'll bring mine over to kind of show you. It's just like all this randomness thrown on a board, but I think I see a theme and like, in there. And so that's how I played it. And then Christine had brought some cute like jars to decorate, and her thing was at the end of the week you can like write something positive that came during that week and like fold it and put it into the jar. And I took the jar, but then I told her this sounds like a lot of work. So I was like, I'm gonna do it for 3 weeks and then not do it, right? So I took the jar, but I was like, you know what? I'm not gonna put my pressure on myself to do this. This seems just, again, New Year starts and we just start putting so many things on our list to do that year, change or, I don't know, introduce to our routines that it's overwhelming. And so even for the vision board, mine is just like random things, but
Please
it's
show
not.
it to us.
Yeah, I will.
For
Let me
those
go
of us
get
who
it.
can see, I'm sure a lot of people can see because they're listening to the podcast, but I'll describe, I'll narrate.
Hey, let's see here. I think
Ooh,
you might
that
be
looks
able to
so
see it.
pretty. I like the feathers.
Yeah, they're just really pretty.
Okay, let me just see what it says. It has feathers on it. It says there's a cutout of, oh my God, new beginning, lipstick, and pictures of like a woman and lipstick there. The something good life. Pick your poison?
Yeah.
Just Gucci. I am so lucky. If not now, when? Power manifestation. Water. Heal, intuition, time, adventure, and something else in below. Fluffy, next to a picture of a cat. Uh, and then there's something, oh, how bad do you want it? And some other things. What am I
Yeah.
missing there that I can't see? Oh, yes, you can. There we
Yes.
are. What else is
Yeah,
there?
and there's like an adventure thing here. What does it say? Time for a new adventure?
Oh, that's what it says. Time for a new adventure.
This is my OG business card that has like a child running with like seagulls flying in the back, and it's like right after sunset. And then there's intuition. I think I put so power of manifestation, what we were just
Yes.
talking about.
What are the
Let's
feathers
start.
about?
Huh?
What are the feathers about? You have like 3 feathers on it.
Yeah, I'm not even sure. I haven't like quite figured that one out. Two of them are right. Like the this is like a plastic one. These are two real feathers, and they're on the cat. So something maybe my cat's gonna be chasing. I don't know yet.
Or maybe you're taking flight.
Yeah. Yes. Absolutely. That's very true. I didn't think about that yet. Um, and this little corner is interesting because I am taken, but I thought that I just saw this and I absolutely loved it.
Oh, it says single taken building my what did it say?
Empire.
Empire.
Yes.
And that's the one that's checked off. You had to like it was like a
Yes.
little checkbox that's next to it. Building an
Yep.
empire. You are.
Yes. And this is a storm. And this is actually where I started. This is from National Geographic.
So I guess it's one of those things where sometimes you need a storm to bring things down so you can build anew.
Mm-hmm.
Chaos
Absolutely.
breeds order.
Yep. And there's a bunch of these teeny tiny unicorns. There's a strip here, but they're scattered throughout if you see the
Huh.
unicorns.
So what do you
And
make of your
pearls.
board? Please analyze it for us.
Yeah, so I mean, it's a lot of like for me it kind of is like I regardless of the fact that I'm feeling like there's going to be new beginnings because there was a lot of new in here. There's a win on top of the new good life, and new beginning and let's start again, and I think those were the life and new chapter is what it says. So
Huh.
I think that there's a lot of like kind of like there's changes coming, and not necessarily a fully entirely new life but a new chapter, and I don't know what that exactly is. I haven't really thought about it, but I think that a lot of believing in yourself, being your own hero, and power of manifestation. The topmost one here says, "Throw kindness like it's confetti."
Oh, I
And
love
that was
that.
like the second thing I put on there after I put the storm on.
Throw
So,
kindness like it's confetti. That's a great one, actually.
yeah. Yeah. And so I think that one of the things that I had written, and so again, this is like, again, the unconscious speaking. When I was like making a little video about explaining that if somebody doesn't have a vision, I still want them to create a vision board. I was writing some things down on my notebook, and I wrote down, um, bring peace to others. And
Hmm.
so I think that the new chapter, and it's going to be more so related to bringing other people kindness and peace, and expanding that work, because even though I've had my mental health spa for and we're gonna come up to 2 years. I feel like it hasn't spread into the community the way I would like for it to,
Mm.
and I think I wanna bring some changes so that I can actually scatter that kindness even further. So, it was really nice because, like, we were like a sold out event last night. So,
And
a
this was
lot
a
of, like,
community event?
yeah, it was a community event, yeah. So, it was really nice. It wasn't all women, there were 2 men there, which was incredible. I love it when men come to the events because, I feel like they, for some reason, are expected to be going and playing some sport or watching some sport or something and not really, like, doing something that would be mindful, and so I love it when they actually come out and join in these activities, and they weren't forced there by any partner or
I
anything,
was
they
about
were
to ask,
there.
were they dragged by their wives?
No, nope, they were both not even friends with each other.
Oh.
So, yeah, they came individually on their own, which I like makes my heart so happy, and I want to do more of that. To bring people in that, don't get an opportunity to do this. There are people that are doing it with their friends and, making it into a party, but there are a lot of people that are not. There was actually one person in the community that had come to a different event and she shied away from doing a vision board, and we tried to tell her that you don't have to have a vision. They're going through some, I think, changes with their, partner and, I think, a engagement breaking off or something like that,
Hmm.
and they didn't come. We tried to really tell her to come in and just do something on there, right? And, she wasn't, there yet. So, hopefully I
And that's
see her at
okay.
another. Yeah.
That's
Yeah.
okay. I mean, I
Yeah.
think that sometimes there's a lot of benefit to concentrating on the now. And the
Yeah.
vision board concentrates more on the future
Mhm.
and where we
Mhm.
want things to go. But sometimes I think all of us, when we're having a really difficult time, just getting
Yes.
through the moment is
Yes.
wonderful enough.
Right, right, absolutely, and the interesting thing is that I did not have any plans, and I did not know what I would find in the magazines or the stickers or, and I just, like, whatever spoke to me in that moment is what I picked up. So, this none of this was planned or thought through or anything. So,
I
you
love it.
know, yeah. So, and that's what I see, and it could be interpreted in many other ways. And, I would love for you to tell me what you think.
Hmm. I let me see this once more again,
Yeah.
please.
Hmm.
All right, let's see. I mean, I think that, like I said, parts of it that has to do with some kind of chaos and breeding into something that is new. And I think that what you mentioned about like new chapters, I think is absolutely right. But it feels also that there is some sort of desire for maybe newness, like
Hmm.
something that um, hmm, that you're trying to create something else aside from what you've already created, like, and maybe a next step, like you said, next chapter. The one that I'm interested in is the "Oh my god," because that seems to be a bit different than all the other stickers. Do you have an idea of what that's about?
So, the storm followed by the confetti was when I put the "Oh my god." I
Ah,
saw "Oh my god," and it just spoke to me. And so I put it on there, and so I'm not sure what the exclamation is about, but, that's an exclamation, right?
interesting. So
Oh
it's
my
not like
god.
it's not like, "Oh my god," like,
Yeah.
it's not a spiritual connection to, like, a higher being, it's more like like a
Yes.
feeling, like, "Oh my god,"
Yeah,
like an
exactly.
exclamation mark.
Mhm. Yep. That's
Interesting.
exactly what that is.
Have you
So,
ever considered doing retreats? Speaking of next chapters.
yes, so I have considered them. My fear with doing like a retreat in another location is that this misconception of you have to leave your life that you're living and go away and take a vacation and break from it.
Mm.
And that's how you're going to find peace. And my thing is that no, because you're going to come back to the same chaotic life. And so I'd rather create events like this where we're, creating something and slowing down and, doing little things in our, day to day where we live, taking a pause here rather than going away.
What about doing like a day retreat within your spa?
Yeah, so this is kind of like a partial day, like not a
Okay.
full day, right? This was like a 3-hour event. So
Mhm.
some of our events are 3.5 hours, so it's their half day longs. Um,
'Cause I
my
would love
my
to join,
idea.
by the way. Like, if you're doing some kind of retreat, this sounds amazing. I wanna
Yeah.
sign up.
Okay. Sounds good. I haven't like I go back and forth on it because I think my concern is that then,
Mhm.
continuing that practice of slowing down in your day to day in the, hustle bustle where we're running around doing our things is, going to be put aside. It's going to be like, okay, well, when's the next retreat? When can I come back and do this? Right? Living vacation to vacation. It's, I've been there, done that. Right? My thing used to be, okay, when is my next vacation? Right? And so I and I don't think that's a good way to live because then you're completely burning yourself out until that day. And that's when you're like, okay, now I can relax. But then
Agreed.
you come back to the same thing. So yeah, but like day retreats, yes. So these are half day retreats. The idea is to maybe bring in some like psychodynamic groups and combine those with all of
Ooh,
this. So doing some just like, process work or some group relations work and then merging the rest of the creativity and the mindfulness, all of that into it. So hopefully that's where maybe that's what the new chapter is going to be.
that sounds amazing.
Yeah.
And kind of piggybacking off of what you said about the daily practice being so important and not living vacation to vacation, I think one of my greatest lessons in life so far has been finding the joy in the day to day and
Mhm.
finding joy in the chaos that sometimes life is, especially after having kids, feeling like time is not as much of my own as it used to be, finding time for myself. It's kind of difficult when your life shifts in such a drastic way. But my kids have also been some of my greatest teachers when it comes to
Mhm.
finding the space in between where you really are leaning into it and saying like, ah, okay, this moment is good. And this is where I'm at now, even with all of the maybe screaming and um, people running around, little people specifically. It's very difficult. And I think for all of us, I think this is just human nature. We get caught up in the day to day life and we forget to really sink into the joy that's in between the sentences of the daily chaos.
Yeah, absolutely. And I and what I say is that with kiddos starting at a young age, right? When you're slowing down to take that breather. One, I completely agree that kids teach you so much patience and to learn to slow down, right? Because they're wanting a lot of stuff. So in order to slow them down, you have to slow down yourself. And so, but like involving them in your own practice as well. But let's sit down, let's take a breath together. Or I'm going to do this like YouTube stretch. Come do it with me, right? They might resist, but then, maybe you'll be using the TV to play that YouTube video and they
Mhm.
can get on their Mario Kart and like they'll be like, "Okay, let me join in." So involving them in those exercises from the get-go so they don't get into the pattern that we got into of go, go, go. They know to slow down at some point in your day to take a breath and, just I think that we ourselves don't go out in the nature as much as we should be. And so then we expect our kids to get off their phones and tablets and video games to go out. But, we're setting the example. So go out,
100%.
go out with them, go on a walk. I've seen some people that will be running when it's like, I don't know, so much snow outside, and I'm just like, "Oh my god, this is so impressive." Well, we all have, like, huge big, huge jackets, now we have, like, these hand-warming things and all of the stuff, like, put your thick coats on and go for a walk with your kids. Throw snowballs at each other. Get out and do those physical activities where you get to slow down. All of you are off of your electronic devices, not just the kids.
Yeah, I think you make a really good point because I am totally guilty of this myself. I carry my phone with me everywhere,
Mhm,
and
mhm,
I'm on my phone a lot, answering texts, checking email, and my kids see that. And
mhm,
then I have to, like you said, I expect them to be like, "You've been watching your iPad way too long, go do something else." And do I do that? Sometimes I do that, but a lot of our
mhm,
activities are surrounding these technological, like screen time,
mhm,
basically.
mhm.
So
Yeah,
you're absolutely right. And when you do take them out, they really enjoy it. Actually, like we went out
mhm,
for skiing last weekend, and it was wonderful, and
yeah,
tubing, and we
yeah,
didn't have screens at all.
yeah.
So
Mm.
you're absolutely right.
Do things where you're putting your phones away, right? Like, because when you don't do that, like, they're also watching that, like, you're still on your computer. And so, um, just it's little things, and they're watching. They're watching those little things and they're
Yeah.
learning. So, if you're gonna be taking that pause, putting everything away, turning your phone on silent, and doing the little YouTube video of stretching and breathing, they're gonna be watching, right? And
Hmm.
eventually will join you,
Absolutely.
because there's nothing else to do. They don't have their iPad or their gaming system or whatever, right? It's no phone time. Nobody gets a phone. Everybody's phone is placed away.
Yes, and nobody gets the phone as key because often during dinner time, I tell them, "Okay, iPads away," and if we have our phones next to us, that creates, like, this
Mhm,
opposing message that we're basically sending, and sometimes
mhm,
I have to remind myself, like, "Oh, no, phone away," and I will say it out loud so that they can hear, like, "Oh, mommy has maybe made a mistake,"
mhm,
but
mhm,
then I'm, like, making sure that I'm putting it away, or
mhm,
even if my kids ask, "Hey, mom, can you please look this and this up? Because for
mhm,
information." And I said, "No, I can't do it now because we're eating dinner. We'll look it up
mhm,
afterwards."
mhm,
So little things like that,
mhm.
definitely.
Yeah. Yeah.
I wonder because I really want to make sure I ask you about this on this podcast.
Mhm,
I am really, really intrigued about your ketamine-assisted psychotherapy that you do, in
mhm,
addition to everything else that you offer in your mental health
mhm,
spa.
mhm, mhm,
Um, I know that a lot of the listeners and viewers will probably be interested in it too. It's been like a new thing on the mental
mhm,
health market.
mhm, mhm,
Can you please tell us, just for those who have no knowledge, have no knowledge about ketamine assisted psychotherapy, what it is, how is it done, what's the purpose?
mhm. Yeah, absolutely. So, before I even started residency, between med school and residency, I did a lot of research work. So, I was at a clinical research coordinator position with a psychiatrist who was at that time looking into ketamine um, as a treatment where somebody acutely suicidal comes in and you can stabilize them with a medicine, not the next biggest medicine, but stabilize them with a medicine so that that acute, suicidal thoughts like come down and then they, can go back into the community and be doing outpatient, you know, treatments. So that's where like I got really interested in it. Like, with her, I wrote like this review paper, looked up everything that there was out there on ketamine at that time and, did a review paper. And I started out on the S-ketamine, the intranasal spray research with her, but I got mashed into residency, so I switched over. But I followed the study because I
Mhm.
knew exactly how the study was set up. And so in residency, I got very lucky because one of the attendings in my residency was also on that study. And he was looking into IV ketamine. And so was the other attending. So they both got onto this study with Janssen, with the drug company of the S-ketamine, the intranasal spray, but they were also interested in IV ketamine. Now,
Mhm.
ketamine is basically an anesthetic. It's a dissociative anesthetic, with some hallucinogenic properties. What
Mhm.
that means is that it's not a psychedelic, it's not a hallucinogen, so it's not similar to your ecstasy or your MDMA or psilocybin. It's not similar to that. It is
Mhm.
different. Ketamine has been used in anesthesia for a really long time with other anesthetic
Mhm.
agents. And of course, the dose is higher, but why do they combine? If there's other anesthetic agents, why would they put ketamine in there? And the reason why they put ketamine in there is because of its dissociative properties. So basically, people will wake up in the middle of surgery. So if they wake up and see their body cut apart, that is very traumatic. And that's where ketamine comes in. It dissociates. So you're not going to remember. They're obviously going to give you more anesthesia right away, but they don't want to give you too much to start with, right? So if you need it more in between, they will give it to you. But if you're waking up, they don't want you to be seeing all of the blood and whatever is going on during surgery. So it helps your brain dissociate from it. So when you wake
Mhm.
up, you don't remember anything of what happened. Um, Half the time you don't even remember what you were mumbling after or what you were mumbling right before you were put down, right? So that's what ketamine does. It works on NMDA receptors in the brain. I'm not going to get too scientific here, but these receptors are known to help modulate depression, and mood. And have some relation with seizure disorders too, but that's getting too technical. So let's move on. The next thing. So what does it do in psychiatry, right? So the esketamine intranasal study, it did show results. I wasn't very impressed with the results. At that time, also due to my attending in residency, he was very supportive, and we had a patient that would keep coming back over and over again. This person had attempted suicide so many times that at some point we were like, you're not being successful at this. Just stop because you're just harming your body. Like, you need to stop. That many attempts, very serious attempts.
Mhm.
Um, and so at that point, we were like at our wits' end. This person was on so many medications. So I brought up to my attending that can we try doing IV ketamine? And he was all for it. He was like, let's do it. So while he was hospitalized, we gave him 3 treatments over a week, so every other day or something like that, and then we discharged him on, Namenda, which is a dementia medication that works on that same receptor to kinda help continue the effect on the NMDA receptor. That's why I brought the
Interesting.
receptor up.
Mhm.
So, and then I think 6 months later, he was admitted again, not with an attempt, just with some suicidal thoughts. I wasn't on the rotation at that time. The attending that was, he did 1 or 2 treatments, and then he was discharged again. And then after that, he wasn't admitted throughout my time in residency. However, some of my classmates went to a NAMI program, and they saw him up and dancing there. He was in a wheelchair. He used to come in a wheelchair. He was
Hmm.
and dancing and having a good time and actually smiling. And so that was just so, like, heartwarming, just that clinical, presentation of that severity to where he's able to actually get out of that wheelchair and enjoy himself, right? Was just so incredible that that's where I was like, and what my realization with that was that while he was getting the treatments, he was still in the hospital and he was doing all the group therapy and individual therapy and getting all that therapy as the treatments were happening. And I stayed with him throughout each treatment. So would talk to him about, okay, what are you experiencing? What's going on? And he would talk to me about, like, he's floating is what he's feeling because it's a very sub anesthetic dose.
Mhm.
So you're not putting them to sleep and they're not 100% dissociated. It is the space between being, completely conscious to completely unconscious, like, not awake, right? You're
Mhm.
right there in the middle. So you're awake, but you're like kind of like having a little bit of an out of body experience of floating or, you know, different kind of experiences. And that's where you almost are like whatever your unconscious is like, whatever your brain is thinking that is not in your awareness is basically a little bit coming to awareness. And maybe not in exact words where you're going to have an epiphany, but whatever comes up, you will be talking to your therapist about that these things
Mhm.
and then getting help kind of figuring out what that meant.
Mhm. So what is ketamine usually used for? I mean, it sounds like for this particular patient you brought up, the patient was very depressed and had a lot of suicidal ideations, or was it more like borderline personality with some depressive things? Like what were you dealing with that ketamine you thought would be a good idea for?
Yeah. So chronic suicidal thoughts, right? And like several suicide attempts in this patient, but chronic suicidal thoughts that like just don't go away. With this particular patient, the borderline personality traits were really high.
Mm.
Um, and I'm glad that did this with a team, right? Obviously, at that time, because it was so starting out, we were doing anesthesia for like, there was an anesthesiologist present. We were on the floor, we did it very in a controlled environment just to see how the dosing is working and, just making sure because it's such a small dose, but we didn't know. We wanted to be very safe.
Mhm.
Um, but yeah, it was severe treatment resistant depression. Um, and the chronic suicidal thoughts,
Mhm.
which, kind of like were the reason why this person was chosen. We did do a few others during residency, and it is very specifically for a certain population. It doesn't work for everyone. So that's something to also be aware of that, it's a very selective patient, chronic suicidal thoughts, can't get rid of them. Whether it's bipolar depression or unipolar depression, that doesn't really matter. Whether it comes down to like an OCD diagnosis or what, it's the thoughts, like nonstop thoughts.
Does
Um,
it have to be suicidal thoughts, or can it be, like you said, OCD? Like, is it just difficulty overcoming loops? Like,
yeah.
what is it really used for then?
Yeah, it's the ruminations. A lot of the
Mhm.
times ruminations of not wishing you were alive or just getting to that extreme of
Mhm.
you wish you weren't alive or my life is pointless. You don't really have to have like I want to kill myself, but just something that is just completely blocking you from living your life.
Mhm.
So a thought that is just holding you back, constantly. You can't sit by yourself with even high functioning individuals, you cannot sit by yourself. So you're a workaholic
Mhm.
or an alcoholic, right? Because of that, because you can't sit down with your thoughts. Now, with substance abuse, we have to be very careful about the people that we choose. Of course, we don't want to be giving, a ketamine treatment to somebody that is actively abusing drugs, right? But, you have
Why
to
not?
figure because, you could do a ketamine treatment and they could go home and use another substance and potentially, harm themselves,
Because there's an
because that
interaction between the drug and the
Mhm.
ketamine?
Yes, or
Mhm.
the cumulative effect of it.
Got it.
Yeah. So
Okay.
you have to, like, be careful about choosing that even though when I do IV ketamine in my practice, they come in, they have 20 minutes to kind of relax because they're coming again from the hustle bustle, insanity, driving in. Somebody drives them in, but just the traffic and like, whatever. So give them 20 minutes to just bring them down. And then I start the IV. The IV goes over 40 minutes. It's very low dose. Like I said, it's weight per your weight. Um, the maximum I've ever done is 1 milligram per kilogram, but usually I have never gotten there. It's kind of I start at point 0.4 and then kind of
Mm.
tweak to where they need to be. Usually about point 0.6, 0.65 is where they end up. So which is really low dose if you talk to an anesthesiologist.
What do they usually use for
Um,
anesthesia?
in like I think 10 or more than
Okay,
that.
so it's like
Yeah,
a
yeah.
fraction basically.
Yeah, this is very sub-anesthetic. Yeah, I don't even know, like, where they start and where they end because, There's people that are using it sub-anesthetic at like 2 or 3 milligram per kilogram,
Mm.
but you don't have to go to that dose. Um, there are people that are using sublingual ketamine for
Hmm.
their treatment, and then there's I believe intramuscular. So there are a few different forms that are being used besides the intranasal and the IV, but I have not seen the results with those as I have seen with the IV ketamine.
Mhm.
A lot of the times either it's like the dose isn't delivered enough or not in the right amount of time, because if it's an intramuscular, we know that it may or may not immediately get to, the body, like the brain, right? It's a
Mhm.
slower release. The way IV is going to be immediately going to the brain, none of these other methods are going to be doing that. And instead of doing higher doses because you want them to have that effect, I'd rather just do, even though it seems invasive, but that's where the effect is, because you're giving this dosage over 40 minutes, right? Then I usually give them another 20 minutes of recovery time. So we're at like what, almost 2 hours at this point. Now, after that 30 minutes of them, like, kind of letting that oozy kind of floating feeling come back, is when we start the therapy. And so then we talk about what they were experiencing during that time. It's important to do it right then and there because people will not remember what they experienced afterwards. And I make very thorough notes. I became that one of those psychiatrists with the yellow notepad and take very thorough notes, because anything that they're saying at that time is very important, even if it doesn't make any sense. Because a lot of them will say, "It doesn't make any sense." I'm just like, "Just say it, whatever it was, like, even if it was, like, the weirdest thing, just say it." And so, a lot of them will be floating or writing something or having that feeling is pretty common, but then there's a lot of other things that come up, going from room to room, certain colors, and different colors will be themes for different treatments,
Hmm.
because we're doing these twice a week initially and then once a week. And so the treatment is anywhere from 8 to 12 treatments. That's the first dash. That's what's found to be the most effective to last the longest, have the longest effect, because it's not something that's going to keep happening. We do that is the first treatment, I guess, would you call it a course, right? The
Mhm.
first course is that much. The notes are so helpful because you're gonna, like, talk through, "What was this?" Have them journal about it as well later, like, kind of, "Okay, could this mean this? Or could this mean this?" Right? You talk about that during that session. Sometimes it's a 1-hour session, sometimes it goes into an hour and a half, so I block a whole bunch of my time to do
Mm.
this, because if it's important, I'm not gonna be like, "Okay, we're at our hour, I'm gonna cut this off," because it might be more that, needs to be talked about. So that's kind of like what the looks like. It's 3.5 hours long, that
Oh, wow.
entire appointment. And, for me, I'm the one that's observing. A physician should be observing. So what I normally do is I have like a little baby camera in the room that they're getting the treatment, because I want it to be dark and quiet. They have headphones, they have music on there. They have like their eye mask. They're just relaxing in zero gravity, whether the massage chair is on or not. Usually it's not on, just it's in zero gravity. So you're having that relaxation position. And, then I want them to have that time. So I have like a little monitor. They raise their hand or they say something, because like it's a one-way mic. So if they need me. So I'm observing them at the same time giving them their space. So
Mhm.
I'm like nonstop available throughout that time period, because I want to be observing if something goes wrong. I don't want like a mid-level to be doing that. I think a physician should be
Sure.
monitoring. Especially because we're not in the hospital, right?
Right.
We're not in the hospital setting, we're in a clinic setting.
So,
So
a few
mhm,
questions, if I may, Dr.
mhm.
Mallick. So, this is an FDA approved treatment for treatment-resistant depression. Is that correct?
So the S-ketamine, the intranasal, is FDA approved.
Okay.
The IV ketamine has not been FDA approved.
Okay.
Here's the reason why. Because IV ketamine is just a generic ketamine that you can get from the pharmacy if you're licensed appropriately. There's no drug company backing it up. There's not a lot of money behind it that would get it approved from the
So
FDA.
there's no one requesting the FDA approval, essentially.
Yes, yes, yeah.
Mhm,
So a lot of the times the drugs that get approved and come to the market quickly are because there's huge pharmaceutical companies that are backing it up.
mhm.
And, the money gets you a really long ways, right?
Sure.
It's like the example of Prazosin, right? Prazosin is a blood pressure medication, but off-label, used for PTSD. Never gonna get an FDA approval for that
Okay.
because
So sounds like there is substantial research on the
Mhm.
IV ketamine, but it's just not FDA approved.
Yes, correct.
So so then the follow-up question is there is a lot of anesthesiologists that
Mhm,
offer ketamine as treatment, very similar to how you do it. However,
mhm.
it seems like it doesn't always follow with the psychotherapy processing. What are your thoughts about that?
It's like having a drive-through, come get your drug.
That's what I
Drive-through
kind of think
alcohol.
too. Yes.
There's not gonna be any benefit without the therapy part of it because you're accessing your unconscious. Okay, let me take that back. There'll be a little bit of benefit because the patient is dissociating from whatever is right now going on and going to this, space where, they haven't been. And so kind of maybe dissociating from those suicidal thoughts for that period of time, right?
Mhm,
Um, However, the effects are not going to be long lasting. So it's going to be like a cycle. The
mhm,
treatments are gonna keep going, right? We don't want it to be a cycle. We wanna give you the 12 treatments. Now, what I do is I send those notes off. If they're not my therapy patients and they have a therapist, I will give all of those notes to the therapist. And they can continue the work because a lot of the times it's reminding the patient, "Hey, this came up. Let's talk about this."
mhm,
So, because they forget, right? 6 months to 1 year, they might need 1 or 2 treatments. It's not gonna be a full 10 to 12, sessions course. It might be 1 or 2 treatments that they need for maintenance,
mhm,
and then, that's the first time around, and then maybe they'll need another round in a year, and then, the Namenda and the lamotrigine also is a medication that works on the NMDA receptors. I will usually have both, prescribed to the patient to kinda
mm,
continue the effect on that receptor, and that's important too. So now here's where the difference is between going to a non-psychiatrist versus a psychiatrist to get this treatment, right? The
so fascinating.
anesthesiologist is not gonna prescribe these medications or know what, a mood stabilizer, anti-epileptic like lamotrigine does
Right.
exactly, right?
That's so interesting. I mean, even I don't do ketamine-assisted therapy, so I didn't even know that Namenda and Lamictal, also known as lamotrigine, can be
Mhm,
prescribed as
mhm.
kind of upkeep for the work
Maintenance,
that you
yeah.
did with the
Mhm,
ketamine. That's really
mhm,
fascinating. You mentioned it's not a psychedelic
mhm,
substance. So
mhm,
we know, as research is showing, psychedelic substances are able to increase some of the neuroplasticity we have in the brain, which helps to essentially rewire certain
mhm,
aspects,
mhm,
especially if you process it with therapy
mhm,
afterwards.
mhm,
A lot
mhm,
of cultural backgrounds, a lot of indigenous people have very similar things in their practice where they have some sort of a substance they take and then they use different rituals to help to sustain and to support the change that's happening. So
mhm,
I see you almost doing that, but this is not a psychedelic. So
mhm.
what does ketamine do without necessarily going into the nitty gritty biochemistry? Is it also helping with neuroplasticity, or is it just a way to kind of similar to hypnosis where you dig into the subconscious and bring it up somehow?
It's doing both. It
Okay.
is doing both, yeah. There is some neuroplasticity, which is why we continue medications to maintain the effect on the NMDA receptor. So it does cause that dissociation from whatever is going on, and whatever they need to kind of like access the unconscious, like you're saying about the hypnosis.
Mhm.
And however, there's also a chemical or receptor effect on there, which is why we continue medication that works on the same receptors to continue that, neuroplasticity, neuronal regeneration, and balancing out of, the amount of, in simple words, chemicals in your brain.
Mhm. So, what does the research show if you're not following up on the Menda and Lamictal? Then is the effect not as strong over time? Like, how is it supportive of the ketamine treatment?
Yeah, so basically it's like, you're not maintaining the effect on the receptors. And
Mhm.
so then they'll need the ketamine treatments more often and to have that continued effect.
Fascinating.
Yeah.
This is so interesting. Like truly, truly interesting. So, have you, if I may ask you a personal question, have you
Mhm.
tried it on yourself at all?
Yeah, so that's like what patients ask me all the time. I have not. That's the funny thing.
I do
But
not meet the criteria for ketamine treatment.
right, right, right. I have considered it to, just because patients say, "How do you know?" And so I have considered it to just do one treatment, with another psychiatrist that does it in the community to see what the experience is like. However, my decision was to go against it just because I had an opportunity to so closely, especially with that first patient that I worked with, be right there talking to them as they were dissociating, that it was like kind of like being right there and experiencing it with them, because it wasn't like afterwards that I talked to them, it was right then and there.
Mhm.
And so I really have gone back and forth on this to whether try and experience what that dissociation feels like. But I will add this on as well. I do recommend a lot of patients do sound healing because the dissociative effect is very similar to what ketamine does. Does it change the brain chemistry? I don't have enough knowledge on
You're
that.
talking about, so, sorry, just to clarify, the sound healing has similar dissociative properties as ketamine?
Yes. It
Fascinating.
does, like, get you in that floating space between that space, the unconscious space, that gets you there. And this is from my personal experience, and I had no idea about sound healing until I met Christine, and she was somebody that reached out from the community, and I started doing sound baths with her because I was like, "Okay, let me see what this is like before I can, like, recommend to at least to my patients," right? And the community people might know what the benefits of it, but at least to my patients. And I have had this experience of feeling like my body is floating on top. Like my
Hmm.
soul is, my body's here, but my soul's kind of floating on top
Wow.
and accessing what was bothering me. What, like, if I in sometimes we're human beings, we can't even access the emotions we're experiencing because we're stressed out. We don't know what emotion it is and where it is coming from, and I have been able to access that doing experiencing sound healing. So now a lot of the times I will tell my patients, "Okay, how about you try this? This is non-invasive, right? And journal afterwards, and we'll talk about what came up." And
Huh.
just,
Do you
so
know of
so
anyone who did both sound bath and ketamine? And can they?
I have not had anyone
Oh,
yet that has done it. I know
to-do
it would be
list.
great, right?
Put it on your vision board.
I know, yeah. So, I have unfortunately not, but it is just, incredible, and I'm very, very lucky to have Christine, that is, she reached out to me. I'm very lucky in that sense. Probably I put that "I'm so lucky" on there for that. Sitting right next to her as I was doing my vision board. I feel, like, literally blessed because her intuition and her picking up on people's energy is so strong because she will pick up on stuff, and she will, a lot of the times, if it's one of my patients that was attending, or like a group, or was doing an individual session, she will come up and tell me later on what, like, she picked up on. She's like, I'm almost wanting to bite my tongue, but I want to tell you this, that this is what I picked up. And she is so on point with what is going on, and, what she picks up energy-wise that, it's just incredible, to see that, and then I will, bring this up in therapy sessions with my patients, and yeah, I mean, they had experienced a similar thing, and that's what was coming up with them, so that's just the most incredible part of it. So I have, like, for me, IV ketamine is not just a fun thing to do. Obviously, it would make a lot of money for me, but that's not the purpose. It has to be for the right person, and other things have been tried before going there. So that's my major thing, because and that's the problem with the anesthesiologists and other people just
Yeah.
offering it to anyone, and like, what criteria are they meeting? What kind of treatments have they had? Have you trained in psychiatry? Like, what is your experience with all of this?
Yeah.
That's where my problem is. A lot of respect to the doctors. Obviously, they know more about ketamine than I will ever know, but unfortunately, not from a psychiatric point of
Yeah,
view.
absolutely. I mean, it's very similar to primary physicians prescribing antidepressants. They can do a great job with prescribing antidepressants, but there's so much more to the treatment, the holistic approach.
Mhm.
Psychiatrists hopefully can do psychotherapy, and if not, they'll refer to the psychotherapist who can. But the psychotherapy piece is very crucial in evaluating and assessing why are we even needing this
Mhm.
medication to begin with. Like it's
Mhm.
just a band-aid, but if you
Mhm.
really want to get to the root cause, you really
Exactly.
need to do this work, the psychotherapy
Yes.
piece. And so it sounds
Mhm.
like with ketamine assisted psychotherapy, the ketamine is in a way a catalyst, but
Mhm.
it's not necessarily the work itself. Like you really need
Mhm.
to do some of the work. And if you
Yeah.
don't, then there it only will go so far.
Yeah. I mean, there's some medicinal benefit to it, but it's not gonna give you the 100% of
Right.
what is helping with this treatment, right?
Right.
There's some effect, obviously, like I said, it works on the NMDA receptors, and we already know in psychiatry that NMDA receptors, help with mood stabilization and help with, like, that's why Namenda is used in dementia, right? To have some neuroplasticity and at least halt the development of dementia, if not reverse it, right? So we do know that since it works on that receptor, there is some, from a chemistry standpoint, a benefit, right? But, it's not gonna be long lasting unless you do the psychodynamic psychotherapy with it and
So
integrate.
speaking of dementia, I mean, I guess the side question for me would be is if we're using the Mended to help support the ketamine assisted psychotherapy, then can it also be in reverse? Can we use ketamine assisted psychotherapy as a support for dementia? Is there research on that?
No, I don't think so. But it is
Good
something
Lord.
that should be, I mean, okay, so maybe there is. I haven't looked into it. So Namenda was just like something. So the attending that I did the IV ketamine with, like, actually did the IV ketamine with, he's incredible. I got a chance to see him again, and I'm always in touch with him. He's still teaches me so much. He is a very, a psychopharmacology guy that is, like, very much like, he taught me what receptors, what medication is doing, what inside your brain actually, right? And so he was the one. It was literally a trial thing. There was no research on this. There was nothing about Namenda, but he just sat down with me and he was like, kind of like, okay, how are we going to help, maintain this effect? The patient was already on lamotrigine, so which is great because I will almost always start people on lamotrigine before going towards IV ketamine because it's a process getting them on lamotrigine, as we know, very small doses and get them to the high dose. So we sat down and we were like, okay, what medication will continue giving the same and similar effect on an MDA receptor? And Namenda is the one medication. So we were like, okay, let's try it. Let's just give it to the patient. Like, there's no harm that's going to be caused from the medicine, minimal side effects. Use it in old dementia patients, right? So, okay. And, it was found to be helpful. So we have patients that we didn't do Namenda and did do, like I said,
And this
this
is
a
published
lot of this
research
stuff.
now.
No, no, like I was gonna say that a lot of this is not published. It's clinical experience with it.
Hmm. So
So
interesting. You're
Yeah.
giving me a lot of ideas maybe down the line. Um, okay. And so you mentioned, for example, that you feel like you could be making a lot of money, but because you're doing it very carefully and you're doing a lot of assistance, that it's not necessarily about that. Does insurance cover ketamine assisted therapy, or is this still kind of out of pocket expense because it's on the outskirts?
Yeah, it is an out-of-pocket expense. You know, people that do have out-of-network benefits, I do create like
A super
obviously a
bill?
60, yeah, super bill
Hmm.
with therapy and other IV treatment. There's a code for that, I guess. So that goes. I'm not exactly sure how much they get back from
Hmm.
it once they meet their deductible, obviously, but the IV ketamine is not approved. S-ketamine, the intranasal ketamine is approved, FDA approved. Like I said, again, backed up by Janssen, a big pharmaceutical company.
Interesting. I mean, I'm hearing about ketamine-assisted psychotherapy a lot these days, and a lot of people do the IV ketamine. It's not like you're like the only clinic that does it.
Yeah.
Um, do you, just for our audience to get an idea, if you are you willing to share just how much would one have to invest in like a approximately, and of course it depends on the region and who's doing it, but
Mhm.
in a 12 session
Mhm.
treatment, how much would one need to invest?
Yeah. Yeah, so I have it like I have the package created for 8 sessions
Hmm.
just because that's where I like to start. So if in case like we're seeing by 7th or 8th that they don't need like, 10 to 12, then I don't want to be I have already billed
Hmm.
them for that much. And the 8 session package is, I believe, discounted to if you pay session by session, it's a little bit more expensive. It's at 750.
Hmm.
A session, or sorry, 850 a session, 7,500 for the packet.
Mhm, mhm.
So, is
And
that
that's a
right?
lot of hours you're putting in there
Well,
into
yeah,
that
like
8
3.5 to 4 hours of
session.
my time is blocked,
Yeah.
right? So my individual psychodynamic psychotherapy, is 350.
Mhm.
So what I'm charging for one session is actually like a deal in that sense that
Absolutely, yeah.
if you did 3 or 4 hours of just therapy with me, that makes a lot more money. But obviously, it's a huge chunk that you're investing in
Sure, and you're
this, and
doing a
so it feels
procedure,
like
you're doing, like, the IV, I mean,
Mhm.
it's a lot. It's actually,
Yeah.
yeah, it's an investment in oneself, but it sounds like a very worthwhile investment if
Mhm.
this is
Mhm.
something that someone really feels like they could benefit from and that you
Yeah.
feel like they could benefit from.
Absolutely, and I don't recommend it to everyone because
Sure.
I'm not going to if it's not gonna benefit you have to meet the criteria, you have to have tried all these things before I will be like, "Okay, no, like, this is really gonna help you."
Mhm,
And it does, like, for those people that cannot absolutely they're stuck, and they're just, like, cannot get out of that cycle and just, do anything, right? Or just, like, be literally sitting with these thoughts and then drinking or smoking weed to numb themselves, right? That is not a way of living that you're working, working, working. And as soon as you have like 5 minutes to sit down, you can't sit down with your thoughts because you're nonstop thinking about, am I in my life?
Dr. Faryal Mallick, thank you so much. This has been an amazing conversation. I think I took you on different journeys within your within your expertise because there's so much to cover. I mean, you are such an interesting person, and your practice is so interesting. Could you please tell our audience how could they find you if they are visiting Tampa? Can they follow you?
Yeah. Yeah, so my Instagram handle is just fmp.mentalhealthspa. Also on Facebook, you can actually look me up. My profile is pretty open, so you can see what I'm sharing on there. Um and then I have a podcast, it's called the How Are You Really podcast.
It's great.
And yeah, and there's just very real conversations with other therapists and psychiatrists and very knowledgeable people, on certain specialties, like eating disorders are not my specialty. So, I bring
Mhm.
on somebody to talk about eating disorders or OCD or, play therapy for ADHD. That's another one that's gonna be coming soon
Ooh,
because it
interesting.
doesn't work for ADHD, and I'm really curious to learn.
That's awesome. So, Dr. Malik, are you ready for our lightning round of questions that we
Oh,
usually do
yes,
here?
absolutely.
All right. Question number one. Oh, Coffee, tea, or silence?
Oh, tea.
Tea. What kind of tea?
So all kinds of teas. I love herbal teas at night that are caffeine free. I have just a huge collection. If I go to a country where they drink a special kind of tea, I will get it. Just to let you know, the Moroccan tea, the Moroccan mint tea actually has caffeine, so don't drink it at night
Yes, that
unless
makes
you're really
sense. Just
awake.
because it has mint in it does not make it herbal. Yes.
Right, right. But, and traditionally, what was introduced to South Asia was the British black tea, but we put milk in it. So we
You make
have
a
our
chai?
chai.
Yeah.
Yeah, we have our chai. And that's what I was having this morning, which has not a lot of caffeine, but just enough. And, I think what would be my favorite tea? I think there is if you can find it, it's hard to find it, but good quality jasmine tea.
Mm.
The that, fragrance, I think, is what takes me back to childhood
Aw.
of, like, the South Asian jasmine or Asian jasmines. I think it's also in other parts of Asia, the jasmine flower. Such a sweet smell. And just having that tease just completely relaxes me, takes me back to happy places.
And I'm guessing you're finding, like, loose tea and then you brew it yourself?
Yes, Lucy. Mhm,
That's awesome.
absolutely. Yeah.
Question number 2. What's one small thing that you do every day that brings you peace?
Slowing down and taking a deep breath, no matter where it is, especially if I am in a stressful situation or I'm going back to back with patients and something, it's too much go, go, go. I will sit down and just breathe. And that just brings me back, grounds me, brings me back to the peace that I need. And that's on a daily basis, just breathing,
I
taking a
love
deep
that.
breath.
I mean, it's so simple, but always so profound. Just bring it back to the breath all the
Yep,
time.
yep, yep, absolutely.
Question number 3. What's one thing people think will make them happy, but rarely does?
Hmm.
Money.
Yeah, I know, definitely money because I have patients who have so much money and still, like I said, those thoughts, right? You're still
Mhm.
stuck in those thoughts, and no money is ever enough. Like, you can't make enough of it. And so I definitely think it's money. Um, Also, I think chasing romantic love, that's
Ooh.
another one.
Tell me more about that, please.
Yeah. So a lot of the times people think that they are incomplete if they don't have a romantic partner. And they're looking for that specific love and, falling in love and being loved. Um, Forgetting that love comes in many forms and if you have so much to give, you can actually give it to anyone and everyone. It does not have to be just romantic love, and you will feel the love back.
I love that. That's very profound.
Yeah.
I mean, what are your thoughts about the lack of sex then? I mean, you can have the love for everybody, your dog, but I think a lot of people would probably want the sex piece in their romantic love. I wonder
Yeah.
if maybe that's somehow intertwined with looking for that love, the sex piece.
Yeah. I mean, I definitely think so, but, like, a lot of the times that lust is confused with love.
Mhm.
And, yes, the mind and body is connected over there as well, but a lot of the times when people are chasing it, they also will have sex with the wrong people, and that does affect your mind and your
Mm.
soul. So again, right? You think that because you now have sex, you are um you're in love now, right? But a lot of the times it's lust, right? So it's temporary, which there's nothing wrong with it, but recognizing that that's what it is, it's
Sure.
lust, right? When it is like going to feel, when it is peaceful and calm and bringing you calm, right? That's where love is. It's friendship, right? And then the quality of sex is automatically much better,
I love
you
that
know?
answer. That's a perfect answer.
Yeah.
Final question for the day. Favorite
Mhm.
book?
Oh, that's a good one. It's called The Gift of Therapy,
Ooh,
by Irvin Yalom.
I love
Um,
him.
yes, that book is just incredible. I have listened to it on, audiobook several times.
Using his voice, or is it someone else?
I believe it's him.
Okay.
Yeah, it's him reading it. And he's just an incredible psychiatrist, therapist, and yeah, that book is just basically the book is for doctors, therapists, but also to the patients. And I think
Mhm,
that's what's beautiful about it is to make it like simple so people can understand what therapy actually is, specifically psychodynamic psychotherapy is,
mhm.
because people don't understand what it is. And so I love the title of it, right? The gift of therapy, because it is a gift, right?
Absolutely. It's funny that you mention it because the book that I'm literally reading right now on my nightstand is by Irvin Yalom, and it's The Spinoza Problem. He writes a lot of fiction that incorporates philosophy and psychotherapy, and he writes a lot of historical fiction, like where his fiction he takes different characters from history and then he creates stories around
Mhm.
their character.
Mhm.
Um, like Nietzsche Wept was about Nietzsche and some other characters, but it's fascinating. I love it. So it's great. That recommendation is awesome. And I haven't read that book yet, so I need to.
Yeah. And I don't know, I've gotten a chance to see him in person once, and he's an inspiration.
Oh, yeah, I think he's getting much, much older now.
He is. He
He's
is.
up there in age.
He's getting close to 100, so
Yep, that's up
yeah.
there.
Yeah.
Well, Dr.
So,
Malik,
but
thank you so much for being on this podcast. You're an incredible guest. You're a wonderful psychiatrist. I really wish that I could attend your day retreats that are not retreats, but the 3-hour workshops. I mean, I would love to do all of that.
yeah,
But
you just need to, like, take a break from the cold in Philadelphia and come down to Tampa.
I think so. But this is why I'm kind of pushing for you to get a retreat. So I have
I
a
know.
reason to go. Selfish reasons here. Um, but thank you so much. Please stay in touch. And
Y
I can't wait to see where this vision board is going to take you and what these
yeah.
changes are going to be.
It's always such a pleasure having a conversation with you. Thank you so much for having me.
Thank you for tuning in and listening. If you enjoyed this episode, please subscribe, leave a review, and share the Quantum Couch with someone you think might love this space too. If you would like to reach out, you can reach me at thequantumcouch@gmail.com. That's my email address. And you can also follow me on Instagram and Facebook. Just search for The Quantum Couch. Thank you for listening. Until next time, I'm Dr. Ina Conboy. Take good care, stay curious, and keep exploring. The information in this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Listening to this podcast does not create a physician-patient relationship with Dr. Ina Conboy or any guest on this podcast. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.